I want to also bring up the issue, obviously, about healthcare and COVID-19. Here's some of what the president and Vice President Biden had to say during the debate.
I think my timeline is going to be more accurate. I don't know that they're counting on the military the way I do, but we have our generals lined up, one in particular that's the head of logistics. And this is a very easy distribution for him. He's ready to go as soon as we have the vaccine. And we expect to have 100 million vials. As soon as we have the vaccine, he's ready to go.
This is the same fellow who told you this is going to end by Easter last time. This is the same fellow who told you that, don't worry, we're going to end this by the summer. We're about to go into a dark winter, and he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
So now we do bring into the stream Chris Meekins, Raymond James Healthcare Policy Analyst. So much to digest there. And also the president last night actually said, when put on the spot, which pharmaceutical companies have their vaccines coming soonest. He pointed to Johnson & Johnson, the single-dose vaccine, which they had halted because of that one person in the study that became ill. What do you think? How are voters interpreting what they had to say on this issue?
Yeah, I think it was a nice change of pace from the first debate. I sat at home with my newborn who came home from the NICU earlier this week, and he was able to sleep completely through the debate. I'm not sure that would have happened last time with all the fireworks that we saw. So one of the things I'd say is I think there are a couple things to keep in mind. Number one, it was a much more traditional debate, and voters seem to be wanting that. And the president got the message after the first debate. The second thing to keep in mind is nearly 50 million people have already voted. So if you had 135 million people voted back in 2016, we think you're probably looking at 150 to 160 million this time. 1 in 3 potential voters have already voted. So how many undecided voters are really out there to be swayed by one of these debates? And with less than 2 weeks to go, you really have to be honing in on your closing message. I think if the president had acted this way throughout the campaign, Vice President Biden may not have a high single-digit lead that we've seen pretty consistent throughout the race. Back in 2016, there were actually points in the race where the Real Clear Politics average of polling had Donald Trump ahead. This year, that's not been the case against Biden. So even if there is a 2016-like polling mistake in the early swing states, I remain very skeptical that that will be enough to be able to propel the president over Biden.
Hi, Chris. This is Emily. I want to ask about healthcare specifically because President Donald Trump, of course, having earlier promised in August to release his healthcare plan, that still hasn't happened. Biden yesterday using the opportunity to really discuss his Biden care plan and some of the proposals there. And I'm wondering, just as you look at this, how important of an issue is this going to be for voters? Is this going to sway undecided voters on the margin here, given that we don't have any substantial plan here from the Trump administration?
Yeah, I think the problem is the Trump administration hasn't really produced a plan of what they want to do. And the Biden administration, people are a little skeptical of the public option and the idea that there could be a government-run plan that competes against the private sector. Last night, I think one of the things that may have surprised investors was that Vice President Biden really did double and triple down on this public option idea. There's been this assumption, and we've seen the really rally in managed care names over the last couple months at this idea that, well, even if Democrats take complete control, the end result there will be that more money is spent on healthcare, and that will be good for the sector. There's a belief that if Democrats only get 50 or 51 Senate seats, that you're not going to be able to have a real debate about a public option, not going to be able to have a real debate about drug pricing reform. So now the question is, will the vice president win? And if so, how big will his coattails be? And what will a potential Democrat Senate majority look like? Is it 50 or 51, or is it 53, 54, 55? And if it's closer to the 53, 54, 55 seats, I think we could see some significant volatility in the days right after the election.
Hi, Jared Blickery here. I just want to ask you, digging into the healthcare sector, looking into the industries and industry groups, what kind of trends could we possibly see after the election? How are you handicapping this? Like anything from biotech to the pharmacy benefit managers out there?
Yeah, I think that's a great question. And from my perspective, it really comes down to what happens in the election and then what the results of it are. And we partner with my other Raymond James analyst on best position names as they're looking forward. And from our perspective, I think that if you do see a Democrat sweep, which we think is the most likely scenario at a 55% likelihood here at Raymond James, then the question becomes, does the filibuster stay or does the filibuster go? If the filibuster stays, and that's the requirement in the Senate that you have to get 60 votes to be able to advance authorizing legislation, so the big stuff you want to get done. And if it ends up staying, then the most likely outcome is just some small regulatory changes, and that's a positive for the group. So whether it's managed care, pharma, biotech, really across the board, that's encouraging. If the filibuster goes away, then there's going to be this perceived threat to managed care and pharma on drug pricing. So I think you're going to see investors flock to areas like med devices, medical tools, is really this safe area outside of the policy debate.
Chris, I'd be willing to put money on no matter who wins this thing, the filibuster is toast. I mean, it's not in the Constitution. But let me shift to this. And I realize you're a healthcare policy expert, but this issue of oil that we talked about just before we introduced you, is that the kind of, can Donald Trump form a final message now on that, or is that only going to resonate in shale oil producing states in Texas? And is it too little too late?
I mean, I think it will help him in Texas, no question about that. And I do Washington policy with a focus on healthcare. And before I got into finance and healthcare, right out of college, I used to run political campaigns. And worked at a political consulting firm for a period of time. And I can tell you, if my opponent in an area where there are jobs directly tied to a specific industry said something that could undercut that industry, I would plaster it every place I could possibly find. One of the problems for the Trump campaign is they actually are running out of money. So what we saw with the death of Justice Ruth Bader Ginsburg was really this unprecedented amount of flood of campaign donations to Democrat candidates, where Vice President Biden had $400 million to be able to spend over the last 20 days and more money coming in every single day. President Trump was running a little short on funds. So it's a type of thing you would want to plaster. It probably keeps Republican control of the Senate, probably makes sure Texas doesn't sway too far away from the president, because it was getting much closer than people thought it was going to be. But the real question is, what will be the impact on Pennsylvania? And I think we just have to see how the Trump administration is able to get that out to the voters.
And we are going to know the answer to a lot of these questions, hopefully, on November 4th, the day after the election. If James Carville's right, we'll know that night, November 3rd. All right.
I think we are going to know that night. I agree with that.
What do you want to say, Chris? Finish up.
I was just going to say, I completely agree with Carville. I think before the market opens the day after the election, we're going to know who controls the Senate and who won the White House. You heard it here first.
And we take your word seriously. 50 million plus people have voted as of right now. So off to the races. Chris Meekins, Raymond James Healthcare Policy Analyst. Always appreciate the folks at Raymond James who help us out on so many different things with your insight. All the best to you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.